Hi, I'm Jessica Zweifach. I'm a clinical psychologist here at the Seaver Autism Center at Mount Sinai. Autism spectrum disorder is a neurodevelopmental disorder characterized by differences in social communication and restricted repetitive patterns of behavior or interests. Social communication challenges include difficulty with social emotional reciprocity, such as trouble initiating or engaging in reciprocal interactions or conversations. Difficulties with nonverbal communication, such as eye contact, gestures, or facial expressions, are also a core symptom. Individuals on the spectrum also often have challenges with developing and maintaining relationships. There are a number of common misconceptions we hear about autism. One is that the idea that vaccines could cause autism. Research has proven that this is a myth, and it was based on a paper from the 1990s that was discredited many years ago. There is no known single cause of autism. However, there are genetic variations and environmental risk factors that are both associated. Another misconception I've heard is that individuals with autism don't have feelings or aren't empathic. This could not be farther from the truth. Individuals on the spectrum might have differences in the way that they express emotions or differences in that nonverbal communication I mentioned. However, they absolutely feel emotions, display affection, and many are quite socially motivated. Early diagnosis and intervention is critical to long-term improvement in skills. The sooner children and families receive psychoeducation and appropriate interventions, the more growth can be expected. Here at the Seaver Autism Center, we are committed to ensuring that all individuals feel comfortable at medical appointments and in the community. To support sensory needs in high stimulation environments, such as a hospital, and to be sure families feel supported, we've developed individualized sensory toolkits that can be used during visits and taken home for future use. We are proud to say that these kits were made as a collaboration with Spectrum Designs, an amazing organization that employs adults on the autism spectrum. Through grant support, we've been able to share these kits with clinics around Mount Sinai. Additionally, we recently started a clinical social skills group here at the center. We're using the Seaver NET curriculum, which stands for Nonverbal Communication, Emotion Recognition, and Theory of Mind training. This program was developed here at the Seaver Autism Center. Through a generous grant, we're able to offer this clinical service to families free of charge. There's both a child and a caregiver component to this social skills training group. Finally, we have developed an online learning module accessible to all Mount Sinai employees on strategies to help support individuals on the autism spectrum in a medical setting. We developed this module after consulting with caregivers of individuals with autism and medical professionals to ensure that the materials address real-life challenges. We are working on further distribution of this module, and we're excited about the feedback we're hearing so far. One common challenge that can come up is finding services and interventions after young people age out of school programs. We all need to do a better job of developing programs for adults on the spectrum. I believe we as a society need to be sure we recognize that autism spectrum disorder affects people throughout the lifespan, and we want to be sure care and supports needed are available past childhood. Here at the Seaver Center, there's a focus on precision medicine and developing interventions based on a genetics-first approach. I'm also really excited about Dr. Seiper's development of a sensory assessment that can be used to look at sensory sensitivities and preferences in individuals on the autism spectrum.